Bismillahirrahmanirrahim. Now we will continue the theory of topic in necrosis. We have seen the table. Now we will see the left remaining theory, which is let's see, nuclear changes. Nuclear changes, the morphologic hallmark of irreversible cellular injury and necrosis are characteristics. This include which changes are the characteristics of irreversible cellular injury and necrosis? Nuclear changes. Which type of nuclear changes? Four: pycnosis, karyolysis, karyolysis, and disappearance of sustainable nuclei. What is pycnosis? Pycnosis is chromatin clumping and shrinkage with increased basophilia. With increased basophilia, we will take basophilia. Whenever we will be MCQs confusing between eosinophilia and basophilia, we will take basophilia. Okay. Pycnosis में basophilia हो रहा है. What is karyohexis? Karyohexis means fragmentation of chromatin. Pycnosis is chromatin clumping and shrinkage, while hexis is fragmentation of chromatin. Karyolysis means breakdown. Whenever there is breakdown, there will be fading. Karyolysis means fading of chromatin material. And then disappearance of sustainable nuclei. Sustainable nuclei will disappear. Liquefactive necrosis, ischemic injury to central nervous system. We have already seen that liquefactive necrosis occurs in CNS and whenever there is bacterial infection. Ischemic injury to central nervous system statistically results in liquefactive necrosis after the death of CNS cells. Liquefaction is caused by autolysis. By which autolysis? And we know that what is autolysis? Autolysis is by intracellular enzymes. Okay. Digestion, softening, and liquefaction of tissues are characteristics. Okay. Liquefactive necrosis, there is digestion, softening, and liquefaction of tissues. These are the characteristics of liquefactive necrosis. Characteristics of some necrosis, some types of necrosis is an important MCQ. Okay, so liquefactive necrosis का characteristics है, that is digestion, softening, and liquefaction of tissue. Suppurative infections characterized by formation of pus, liquefied tissue debris, and neutrophils by heterolytic mechanism involve liquefactive necrosis. So we have seen that liquefactive necrosis से related 2 points हैं. One is CNS and second is bacterial infection, suppurative infections, and there is liquefied tissue debris and neutrophils. Heterolytic enzyme, we know that in heterolytic enzyme there is no involvement of intracellular enzyme, but there is involvement of extracellular enzyme, for example by bacteria and some others organisms. Okay. Then we will see caseous necrosis. Caseous necrosis, this type of necrosis occurs as a part of granulomatous inflammation. Whenever there is granuloma inflammation, there will be this type of necrosis, caseous necrosis, and is a manifestation of partial immunity caused by the interaction of T lymphocytes CD4 plus and CD8 plus, and CD4 minus and CD8 minus, macrophages, and probably cytokines such as interferon gamma derived from these cells. Okay. Caseous necrosis, we will sum it as granulomatous inflammation, part of granulomatous infection, and it's part of partial immunity caused by interactions of with T lymphocytes CD4 plus CD8 plus, CD4 minus CD8 minus, macrophages, and probably cytokines such as interferon, which are produced by this T lymphocytes. Okay. Tuberculosis is the leading cause of caseous necrosis. This is an important MCQs. Tuberculosis में हमारे पास किस टाइप की necrosis होती है? Caseous necrosis. Okay, so this is an important MCQs. Keep it in your mind. Caseous necrosis combines features of both coagulative and liquefactive necrosis. This is an important MCQ. Which type of necrosis combines features of both coagulative and liquefactive necrosis? Coagulative necrosis plus liquefactive necrosis. Characteristics. This is the answer is caseous necrosis. On gross examination, caseous necrosis has a cheese-like or caseous consistency. So in caseous necrosis, on gross examination, what we will see is cheese like or caseous consistency. This is an important MCQs too. Okay, C for caseous and C for cheese like appearance. On histology gross examination पे cheese like appearance है. On histologic examination, on histology, what will be on histologic examination? Caseous necrosis has an amorphous eosinophilic appearance. Okay, हिस्टोलॉजिक ग्रॉस एग्जामिनेशन पे चीज लाइक और केजियस कंसिस्टेंसी है, जबकि हिस्टोलॉजिक एग्जामिनेशन पे एमॉर्फस इसोनोफिलिक अपीयरेंस. ओके, गॉट इट. इग्नोसिस में बेजोफिलिया था, जबकि हमारे पास जो है केजियस नेक्रोसिस उसमें एमॉर्फस इसोनोफिलिक अपीयरेंस है. गॉट इट. डोंट कंफ्यूज दिस पॉइंट्स. Gangrenous necrosis. This type of necrosis most often affects lower extremity or bowel and is secondary to vascular occlusion. We have already seen in table form that gangrenous necrosis is caused by occlusion of blood supply to lower extremities or bowel. Mostly we have seen that it's mostly arterial occlusion. Okay. When complicated by infective heterolysis and consequent liquefactive necrosis, gangrenous necrosis is called wet gangrene. What is wet? Okay, gangrenous necrosis has two types: wet gangrene and dry gangrene. What is wet gangrene? Wet gangrene. In wet gangrene, there will be infective heterolysis and consequent liquefactive necrosis. Okay. When characterized primarily by coagulative necrosis without liquefaction, without liquefaction, then it will be dry gangrene. Get this point. Okay. When characterized primarily by coagulative necrosis without liquefaction, gangrenous necrosis is called dry gangrene. Okay. Then now we see fibrinoid necrosis, and what I remember from the table is that fibrinoid necrosis, there is deposition of fibrin and it is an autoimmune disease, and there is a smudge pink appearance. Okay, and it is different from coagulative, liquefactive and caseous necrosis because there is no occlusion or there is no ischemia, while in the mentioned necrosis there is a occlusion of blood supply. Okay, fat necrosis is also different from the rest of the necrosis like coagulative, liquefactive. Okay, and caseous. Fibrinoid necrosis. There is deposition of fibrin like proteinaceous material. Which type of material? Proteinaceous material in arterial walls appears smudgy and acidophilic. Okay, appears smudgy and acidophilic. Okay, not basophilic. Basophilic हमने अभी तक किसमें देखा है? सिर्फ उसमें देखा है pycnosis में. And pycnosis is a part of irreversible cellular injury and necrosis. While in fibrinoid necrosis and caseous necrosis, there is in fibrinoid necrosis there is acidophilic, while in gangrenous while in caseous necrosis there is amorphous eosinophilic appearance. Keep these things on your mind. These are important things to remember. So, fibrinoid necrosis is often associated with immune-mediated vascular damage. Okay, it is a vascular pathology. Now we will see fat necrosis. Fat necrosis occurs in two forms: traumatic fat necrosis and enzymatic fat necrosis. Traumatic fat necrosis, which occurs after severe injury to tissue with high fat content such as breast. ब्रेस्ट में हमारे पास फैट नेक्रोसिस होगी, और कौन सी वाली नेक्रोसिस होगी? ट्रोमेटिक फैट नेक्रोसिस, व्हेन एवर देयर विल बी इंजरी. ओके. Enzymatic fat necrosis, which is a complication of acute hemorrhagic pancreatitis, a severe inflammatory disorder of the pancreas. Okay, pancreas में हमारे पास enzymatic fat necrosis होती है. This is an important MCQs too, कि हमारे पास pancreas में कौन सी type of necrosis occurs. Okay, so enzymatic fat necrosis. Proteolytic and lipolytic Pancreatic enzyme diffuse into inflamed tissue and literally digest the parenchyma. Fatty acid liberated by the digestion of fat form calcium salts. Saponification or soap formation. Soap formation occurs in which type of necrosis? Enzymatic fat necrosis. Okay. Vessels are eroded with resultant hemorrhage. Okay, so it was all about the remaining theory of necrosis.